Hi, this is Dr. Roy Hall, and I want to welcome you to the Bioidentical Hormone Balance, Age Healthier, Live Happier. This is a very exciting topic, and we've been utilizing this program since the spring of 2016 and having some very good results, very exciting results, and I have to say both myself and my wife undergo hormone replacement or optimization using what we'll be talking about during this program here. There's a lot of questions over hormone administration, safety, efficacy, and what we're going to do today is talk about what you need to know, who and what you can believe, and what you could potentially do with getting your hormones optimized. What hormones do is they give us the ability to be fully present and productive each and every day, creating health, wealth, and abundance in all aspects of life. This is a topic that really wasn't brought up much, say, 50 years ago because people were dying so much earlier, but now with people living into the 80s and 90s and 100s, we need to optimize these hormones. Otherwise, we go through 20, 30, 40 years of life in agony. And this life in agony can cost us financially, it can cost us emotionally, physically, and spiritually. So this is a very important question in the 21st century. As we are living longer, we need to live better. Quality is so much important in living a good life. Folks ask, what are hormones? Well, the chemicals made by the glands that act on certain actions of cells and organs. They allow the body to communicate with each other. They are specific messengers. They can be gender specific. Male and females often have different hormones or different quantities. In actuality, we have 1 billion messages going on each second in our body from hormones throughout the body. It's not a instance that happens maybe once a day or twice a day, but billions of times every second throughout the body. Some of the examples of hormones, number one is vitamin D. This is a hormone. The body does make some D, and a definition of the hormone, it's made in the body and it travels in the bloodstream to another organ to cause a effect. Thyroid producing hormones, estrogen is a hormone, progesterone is a hormone, testosterone and cortisol are all hormones, and all of these except the progesterone, and even progesterone is made in small amounts with men. So all of these do occur in both sexes, but the two sexes have different amounts, and we have different amounts throughout our lifetime. Now we think of hormone imbalance as being shown in this slide here with the different emotions, from just you want to scream or pull your hair out because you're so frustrated, to you want to punch somebody in the face because you're mad, or all kinds of things. And this is what we associate hormone imbalance with, and this is seen in hormone imbalance. Big question, particularly with functional medicine doctors, is how do you feel? Laboratory studies are very important in looking at the lab values, but more importantly than the lab values is how do you feel? Do you feel like you just want to blow steam out your head, or you just want to shout as loud as you can? If so, then let's start looking at these hormones and let's get them back in balance. Any of these issues look familiar here. You know, you go to the swimming pools in the summer, you'll see a lot of examples of the fellow on the right, and this is a feminization of the male, and that results because overabundance of estrogen in relationship to testosterone. And what ends up happening, men do develop these man boobs like you've seen. On the left, very common with women, you just feel frustrated, you're tired, you can't think straight. Not sure what the slide is on the bottom. Well, I know, but I'm just not going to talk about that. Yeah, we will talk about it a little bit down the road, but not right now. Everyone knows about menopause. Men have the same thing, and it's called andropause. And here's a picture of andropause in its worst example. Fella is tired, he's fat, he's sitting back watching TV, drinking a soda. The only one living healthy is that dog on the right on the treadmill. And this is a good example of what happens to andropause with men. As they go through the changes, they lose all drive to be active. They start losing their physical stamina. They start losing their physical or their physique, and becomes a vicious cycle. The more you lose, the more you want to eat. The more you want to eat, the more you lose, and it just perpetuates itself if left untreated. So the question is, you want to feel like the pictures before these, or you want to feel like these two people here? And we're not talking about just being beautiful like these are nice looking folks here, but I guess they're demonstrating an air of confidence. They're demonstrating satisfaction, smiling, happy. This is what the hormones are known to bring about when it's optimized. Now, what happens when our hormones are out of balance? Well, people have extreme fatigue. They hit that wall late in the afternoon. They just can't go any further. They start having these mood swings from highs to lows. Anxiety increases. Tension and irritability increases. Difficulty with sleep. People start waking up early in the morning, unable to go back to sleep. How many of you have ever walked into a room and forgot why you walked in that room, or forgot where you place your car keys or your cell phone? Hormone imbalance can result in depression, feeling glum, no energy, lack of focus. There's brain fog, and this happens in both men and women. Hot flashes and night sweats begin to occur, and it's important to distinguish the two because they are treated differently and they're caused by different issues, and many doctors not trained in hormone therapy confuse the two. Hot flashes typically occur in women, and they'll occur somewhere middle of the chest, rising up to the head, maybe the upper extremities, but primarily the chest and head, and last but a few moments. These are responsive to estrogen, night sweats. In contrast, the whole body gets hot. This is where, when you go to work, you keep a fan under your desk to keep your legs cool, or a fan blowing on you. The name is a misnomer because these can occur at night or they can occur during the daytime, but typically the whole body's involved with this heat flash, this heat sensation. And these are not responsive to estrogen, but responsive to testosterone. So it's important to know this distinction so that you treat it appropriately. Hormone imbalance results in weight gain. It becomes very difficult to lose weight even on a good diet. People again have joint pain. There's testosterone receptors in all bones and all joints. And when the hormone is optimized, a lot of times the pains get better. People start having migraine headaches, severe headaches, bladder symptoms, inability to empty the bladder, urinary frequency. And of course, when we all know the decreased sex drive, low libido, not beetles, but low libido, and difficulty with erectile dysfunction with the gentleman. All of this does sound familiar, right? All of this can happen with hormone imbalance. And these are many symptoms that many of us have that just are not being addressed. And think of the quality of life that's being missed by not addressing these issues and correcting the problems. That's why we need to talk about hormones. Ask yourself, if you had your hormones optimized, how will that help you? How would you feel? Could you be more productive at work, more productive in your relationships? How do you want to feel? How do you really feel? Any sense of depression or just being down? What about your loved ones? How do they feel, and how will they respond differently if I feel my optimal? Now I want to give you a story of two women, and these are two twin sisters. And this is not unusual, but a picture that we see very often. And at age 35, both twins are suffering from the same symptoms, which include depression, anxiety, irritability, mood swings, fatigue, weight gain, low libido, and sleeping difficulties. So what happens with Carol, she visits her primary care practitioner to address her concerns, and her sister Ann, feeling her symptoms were more hormone related, sought the advice of a hormone balance expert. Carol, after a quick consultation, because there was just limited time in the office, her doctor put her on an antidepressant, but failed to mention it would decrease her sex drive even more and could cause even more weight gain. And after an extensive, in-depth consultation with a hormone expert, who then determined that she was suffering from premenopausal symptoms of testosterone deficiency and not depression, ordered lab tests and placed her Ann on biologic hormone replacement therapy for 5 years, and she starts feeling great in a matter of a few weeks. On the other hand, Carol, after 5 years, is now more overweight, has no sex drive whatsoever, has no energy, and her doctor prescribes a diet pill, an anti-anxiety pill, and a sleeping pill, all to treat her symptoms. In another 5 years, this is what's happening. Carol returns to her doctor, all with the same symptoms. Labs show that her cholesterol has risen more. Rather than counsel her on lifestyle and diet changes, she started on a statin drug to lower the cholesterol as well. So she continues with the antidepressant, the sleeping pill, the anti-anxiety pill, and now a statin therapy, and a diet pill. Whereas Ann is feeling much healthier, she's aging healthier, she looks better, she's happier, and she's doing things a 45-year-old woman should be doing in life. She's having a good time. Problems: Carol's doctor, family practice doc, or internist failed to mention to her that statin drugs can cause liver damage, muscle breakdown, possible kidney damage. It's also been associated with Alzheimer's, diabetes, and cancers. And the fatigue and muscle pain she's experiencing is discouraging her even more from exercise, and she now gains even more weight, which adds more to her depression. So she's spiraling downwards. Now at age 50, Carol had had a period for 6 months. She's complaining of hot flashes, mood swings, night sweats. Her doctor now prescribes a hormone pill, but it's a synthetic, and it's been shown to increase blood clots, heart attacks, strokes, Alzheimer's disease, and breast cancer. Her hot flashes are likely gone, but she still has no sex drive or energy, and she's still overweight. She's now on 7 different medications, whereas Ann, who went to the hormone replacement person in the beginning, is still aging healthier, living happier on biologic hormone replacement therapy, and she's on no medications for depression, no medications for sleep, no medications for anxiety, no medications for weight loss, no medications for cholesterol. Yet she's healthier, happier, and her lab studies are better. 5 more years, Carol stops taking her oral hormones because she does not like them. She's miserable, and she's afraid of developing Alzheimer's because she can't remember anything at this time. Her practitioner now finds that she has bone loss from a bone density test and starts on another medication such as Fosamax for her bones, but it gives her nausea and chest pain. Her blood pressure is now up, and she's developed diabetes type 2, put on 2 more medications to help lower her sugar. You know the story of Ann. She's still aging healthier and happier, and on no medication except the hormone replacement therapy. Now at age 60, Carol's practitioner has not understood the importance of her hormone balance, and she's now on multiple medications. Hormones are a key to her mood, her mental clarity, her anxiety, bone building, heart health, also diabetes prevention, weight control, breast cancer prevention, and Alzheimer's. She's on multiple medications which are treating multiple symptoms, but not one of these medications are treating the cause of her problems. Her cause is because her hormones are out of balance. And on the other hand, well, you know Ann, she's healthier, happier, and feeling good. So at age 60, Carol is miserable. She's tired, depressed, overweight, irritable, can't think, and has no sex drive. And on the other hand, an identical twin feels great, looks great, has energy, mental clarity, sharp focus, and an amazing sex drive. Which story would you like to tell to your spouse, to your children? Which one had the best outcome? We know that. Which one had the most problematic medical history? Which one had the most financial complications? It's the one on the left. It's Carol. And this is what's happening. Traditional medicine is failing our people on helping us get well. This is an old slide, 2006. The new slide from last year shows the number 3 cause for death in this country is not cerebral vascular disease, but it's medication errors and hospitals. Number 1 is still heart disease, and we see more heart disease after women go through menopause. We see more cancer and have more cancer deaths, but medication is now the number 3 cause for death in this country. All those medicines that Carol is being placed on is causing problems such as death and other complications from these medications. In fact, last year in this country, over 450,000 preventable medication errors were made, or 450,000 medication errors with complications were seen in this country. And if you divide that by 12, that's 37,500 medication errors causing serious problems every month in this country. Now, I live in Montana, and if you get on Google and Google the population of Bozeman proper, 2016, you'll find that their population was 32,500. So just imagine everybody in Bozeman and Montana every month of the year having a serious medical complication from medicines they're taking. We're in a crisis right now because of medications people are taking, and it's getting worse, my friends. It's not getting better, and people are taking more and more medications. In fact, in this country, no, in this world, the United States takes 50% of all prescribed medications in the world, but we only have 5% of the population. And last year, the pharmaceutical companies spent more money marketing to me and you in this country than they did on research and development of new medications. And again, this is an old slide. The new slide would say this is the third leading cause of death in the country. Last year, again, it was 750,000 severe reactions. So when we look at heart disease, pre-menopause, it's 1 out of 7 women have heart problems. After menopause, when the estrogen and testosterone levels are very low, it goes to 1 in 3. Do you think there might be a relationship here between hormone value and cardiovascular health? What the hormones do is they help control hot flashes, they maintain bone density. In fact, testosterone will add almost 10% new bone growth a year for men and women having the testosterone optimized. And this is a young spongy bone, so when you fall, the bone bends. It does not break like it does when you fall after taking Fosamax. Testosterone, estrogen, and progesterone, all three help maintain memory. They reduce the risk of colon cancer. They maintain collagen in your skin so you have fewer wrinkles. They increase serotonin and dopamine, and these are the happy hormones. And smoking and stress will decrease your estrogen. Now, testosterone is called the brain hormone. It provides help in maintenance of health in bones, brain, breast, heart, and joints, and relationships. Women, you ladies lose your testosterone faster than men, and it begins in your mid-20s, and you'll lose approximately 50% of your testosterone each year. So you start out at 100%, the next year you're down to 50%, the next year you're down to 25%, the next year you're down to 12.5%. Whereas men, we lose it slower, and it doesn't begin until somewhere in the 30s to 70s. We'll lose only 1 to 3% of total testosterone each year. And yes, as women make estrogen and testosterone, your testosterone's made the fatty tissue. We are fed by the food industry in this country, which is leading us astray. It pays no attention to health. Look at the commercials on TV and see how much information is going to the adults and to our kids each day on eating unhealthy foods, unhealthy sodas. And we're being treated by the health industry, which pays no attention to food. Go to any hospital cafeteria and look at the food they have in that hospital. Many of them have a McDonald's or a Burger King within the hospital itself. Now, there's several options for hormone replacement, and we have the bioidentical hormones and the synthetic hormones. In this country, which the synthetic reigns, and primarily we're limited to pills, patches, and shots. With the bioidentical, we have a few more options. We have troches and pellets that are placed under the skin. Problem with the pills on the synthetic or the troches that people suck on with the bioidentical is these are very anti-inflammatory to the gut, and people have a lot of GI issues. Problem with the patches, the creams, and the gels is, number one, people's absorption through the skin is very variable. Remember, the skin is put on us as a barrier to keep things out things in the environment out of our bodies. And so why would we expect something on a patch to get in easily or something in a cream to get in easily? Other problem with the gels and creams is dosing. Who's giving you the right dose today versus the amount you put on tomorrow, because it's very variable. Another problem with the creams and gels is related to contamination. If you read the instructions for the creams and gels, that you put it on and then you have to wait so many minutes for the gel or cream to dry on your skin before you put your clothes on, so you don't wash it off or rub it off onto your clothes, and then you got to wash your hands thoroughly so you don't contaminate somebody else in the household, and then you're supposed to rinse at the sink so somebody else doesn't come by and get extra testosterone by washing their hands or brushing their teeth in your sink. Shots are very good at getting hormones in, but the trouble with these is they do not maintain a good blood level, and people's blood levels are going up and down, up and down. In fact, several years ago with men on testosterone replacement via injections, it was being given once a month, then it went to twice a month. Now it's up to twice a week, and still you go through several days each week with low blood levels. The potential side effects of the oral hormone replacement therapy, and these are primarily the synthetics. First, we have problems with peak and valleys, with the blood levels going up and going down. We also have a problem with first pass metabolism, which means you take it by mouth, it then goes to the liver where it's detoxified, and so you have less of this in the blood system. They can cause breast stimulation of tissue. There's increased risk of endometrial cancer and breast cancer with the oral HRTs. It's something people have to take every day, so there is a problem with non-compliance with people just simply forgetting it. We see problems with vaginal bleeding, blood clots, headaches, nausea, vomiting, fluid retention, leg cramps, and gallstones. Which of these would you like to have, and how many would you like to have, and still hope to have a good quality of life? None of these are desirable here. The traditional progesterone administered by traditional medicine in this country is really not a progesterone, but it's a progestin. It's made from the horse urine, and so this is where this cartoon comes from. And the horse says, "You want to give me what?" And it's human estrogen. And the horse says, "No, no, no." Back in 2000-2001, a large study called the Conventional HRT Study, or Women's Health Initiative Trial, was performed on a large amount of women, and what they found was 41% increase in stroke, 29% increase in heart attacks, 26% had new breast cancers, twice as many blood clots, and 76% of people had increased Alzheimer's. And after this, 65% of all women stopped their hormones abruptly, 2001. Either they wanted to stop it or the doctors became afraid and stopped it, and they were not offered any alternatives for hormone balance and symptom relief. And unfortunately, there were methods available, but the traditional U.S. doctor was not aware of these or decided not to pay attention to these options for these patients. So many of these women went without hormones for many, many years. And the problem with the study is listed here. They were looking at the wrong drug. They were looking at synthetics versus bioidentical. They're using the wrong dose rather than being titrated for age and blood results. And they were all administered by the wrong route. So then we had estrogen patches developed. And estradiol levels in the women are somewhat better than pills, but not as good as pellets used with the bioidentical. There's an adhesion problem with these patches. If you get hot and sweaty, they don't stick on, and then they need to be changed throughout the week. We do notice some weight gain, but there's less fluid retention than being on a synthetic or horse estrogen. However, again, the problem is 45% of the people do not absorb the medication through these patches. The skin is doing what it's designed to do, and that's to keep things out of the body. Creams and gels we mentioned. The problem with these, did you apply enough? Did you apply too much? You have to remember to rub it in daily. It has a very short half-life, which means it may need to be administered twice daily. And remember, every time you administer it, you have to wait for it to dry before you put your clothes back on. Otherwise, it gets rubbed off into your clothing. And it can be transferred to others, babies and pets. You put it on with your hand, then you go caress your baby or pet the dog on the top of the head. And the most important thing is the estradiol in these products does not have bone, heart, or brain protection that the pellets offer. TESTIM is a cream that men use, and the normal values for testosterone in men varies between about 200 to 8 to 900 nanograms per DL. This chart shows going from 0 to 500 nanograms per DL. And the problem with this gel is if you looked on the baseline, the blue line, this is where this one patient started. And then in the drug study, they had patients taking TESTIM 50 milligrams, that's the maroon line, and then 100 milligrams a day, that's the orange line. And you see it only raises it up max to 450 nanograms per DL. We know with testosterone, if we can get your hormone level above 600 nanograms per deciliter, your overall mortality rate is going to drop significantly from all causes. And these causes include heart disease, strokes, prostate cancer. And if we can get your levels up above 900, it's even going to decrease your chance of prostate cancer. But with this cream, there's no way we can get it up near 900 or even close to 600. That's the problem with the creams, is your amount of absorption is very limited. Then with men, we have injectable testosterone, as I mentioned beforehand. Initially, this was being given once a month, and then we saw that the drug levels were high, but did not stay high. So then we went to twice a month, every 2 weeks. And then we went to once a week, and still folks are having low blood levels, so now the recommended dosing is at least twice a week. But what ends up happening, you go from a very high level of the testosterone to a very low level within a matter of 1 to 2 days. And the adverse effects of using the synthetic testosterone is liver issues, heart disease, increased prostate cancer, and elevated cholesterol values with elevation of the LDL, VLDL, and decreased HDL. None of these affording the man protection from health crisis issues. Now, most functional medicine docs, when we replace hormones, we use bioidentical hormones, which means they look just like the hormones you and I make. We use a pellet, as seen in the hand of this one person here. These are non-synthetic. It's derived from yam, and with it being bioidentical, it means all the studies done on it, from biochemical studies to NMR studies, it all looks just like the same hormone that you and I are making. And in men, these pellets will last up to 4 to 6 months, so you're not having to do an injection every 2 to 3 days. And it's the most widely studied form of natural hormone therapy. These bioidentical hormones have been around since 1939 in Europe. And in Europe and Australia, this is the most common way of replacing hormone therapy. Not used as much in this country because these are bioidentical hormones, which means they're natural, and you can't patent something natural. You can't patent water, you can't patent dirt, you can't patent estrogen or testosterone. And so our drug companies here say, if you can't patent it, we ain't using it, and we'll generate something that looks sort of like it, but it's going to be a little bit different. With the dosing of the pellets, it's based upon your age, your weight, your blood values, your medical history, and it's over 1,000 different dosing protocols we have on replacing these with our people. What ends up happening when you look at the various forms of administering hormones, if you looked at the oral rat, which is a pill, or the troche that you suck on once a day, you see you get a very high peak or a good peak, and this is a white line, and then it drops, and so you're back to baseline the next day, and you have to repeat it, so you spend up much of your day with low levels. When you use a patch, you get somewhat more even drug level, but still at the end of so many days, you're back to baseline, you have to put on a new patch, so you're going quite a few days with low drug levels. When the pellets are implanted, we get a high drug level, and that stays present throughout the time or life of that pellet. And with women, that's usually about 3 months. With men, it's around 6 months. So again, I mentioned these were developed in 1939 in Europe for women who have had radical hysterectomy. So there's over 80 years of research out of Europe and Australia. Most widely used form of replacement therapy. And both estrogen and testosterone are used for the treatment of menopause with women. In this country, with the synthetics, we have no approved testosterone to give women. Here's where most people get their medical advice, and it's from television, commercials on TV, rather than asking your doctor. And again, the doctor gets most of his advice from the same site or from the pharmaceuticals who make the synthetic hormones. Here's a great slide I like that I show everybody in our clinic. And again, most men vary between 200 and 900 nanograms per deciliter. I'm 63, and I'd say majority of the guys, 45, 55, 65, are in the 250 to 350 range. And so again, if you're using the creams, you're only going to bump it up maybe 50 points, so you're not going to go very high. With bioidentical hormones and use of pellets, we want to optimize your hormone level, and we want to get the men up between 900 and 1100 nanograms per deciliter for most of the time, or at least 50 weeks out of a year. And again, it's important that if we get you above 600, the overall mortality rate goes down. You'll notice at the bottom that erectile dysfunction is one of the last things to go with drop of testosterone. You start losing your protection against other issues such as Alzheimer's, prostate cancer, osteoporosis, diabetes, heart disease, way before you develop difficulties with erectile dysfunction. Now, this is not to say all erectile dysfunction is secondary to hormone imbalance, but this is a major contributor. Again, with most men in their 50s, 60s, 70s, and a lower range, this is what's going to be affecting many of them. Testosterone is a bone builder. As I mentioned a while ago, it adds at least 8% of new bone growth per year, both men and women. This is the best way to prevent osteoporosis. It's the best way to treat osteoporosis and osteopenia. Look at the response rate compared to the synthetic estrogens, and you see it's much different. The Nurses' Health Study in 1995 suggested that conjugated estrogens increase the risk of breast cancer. What has later been seen as estrogen plus testosterone, there's no increased risk of breast cancer. So you need both of these to have protection. One will stimulate it, but giving both will add protection against the cancer. Another study in the Archives of Internal Medicine. This is, I'm looking for the date on here, I don't see it. What they demonstrated was testosterone prevents stimulation of breast tissue, lowers the risk of breast cancer. Without the testosterone, the estrogen will stimulate the breast tissue, and you'll have increased cancer with that. So again, you need both compounds for protection. Testosterone delivered by pellet implants does not increase the risk of breast cancer, unlike the oral synthetic methyltestosterone. Testosterone implants also had less stimulation of breast tissue, and combined treatment with testosterone estradiol does not increase the risk of breast cancer, even in breast cancer survivors. Women who have already had cancer, there's no increase. Interesting, women get Alzheimer's in a ratio 8-to-1 over men. Women on estrogen are 50% less likely to develop Alzheimer's, and men with low testosterone are 3 times more likely to develop Alzheimer's. So what side of the fence would you like to be on here? When utilizing bioidentical hormone replacement, the British Medical Journal 1993 saw no increase in blood clot activity, saw a reduction in cardiovascular risk compared to oral therapy, and no increased risk of breast cancer. Replacement of estrogen with pellets or bioidentical has a positive effect on body fat in postmenopausal women with decreased body fat, along with improved lipid parameters. Realize in Europe they do not use statin therapy for high cholesterol, but it's diet, lifestyle, and optimization of hormones. Would you rather be on a statin therapy, feeling poorly with muscle cramps, running the risk of diabetes, Alzheimer's, and cancer, or having your hormones optimized, eating good food with lower cholesterols? And note, after 2 years of marked reduction in fat mass when both estrogen and testosterone were used in combination, and the beneficial effects of testosterone on the heart. Both estrogen and testosterone stimulate pre-cartilage cells, possibly reversing development of arthritic tissues. Many people do have improvement of their arthritis with simple hormone replacement therapy. And here's what our world has done with geriatric gone wrong. We have these centers where we sell wheelchairs to old people. We have these bathtubs with doors on it because you're too old, you're too sick, you're too tired to lift your leg up over the rim of the tub to get in. It'd be much nicer if this was replaced with exercise equipment, sporting equipment for people who had their hormones optimized rather than people who had lost all their hormones. The joke in the hormone business is, do we grow old because we lose our hormones, or because we lose our hormones we grow old? And again, this is an important question to ask that wasn't asked 50 years ago when people died so much earlier. Now that we're living longer, we need to go back and re-ask this question: what happens when we replace the hormones we lost 20 to 30 years ago? Okay, prostate cancer. High levels circulating testosterone are not associated with increased prostate cancer. Study out in 2004. Blood levels of androgens and other sex hormones are not related to the risk of developing prostate cancer. 2008. Then 1 year of testosterone replacement therapy. Men did not have a greater increase in PSA nor increased occurrence of prostate cancer. And this is 2003. Studies after studies are showing that testosterone replacement with bioidentical hormones is not associated with prostate cancer and is not contraindicated in men with prostate cancer. So you got an old car like this. Would you like to put new gas in it? Or would you rather keep that old car looking nice and new and keeping running it like it's supposed to be running? You decide which one you like, which one makes more sense to you. So the take-home key messages: hormone imbalance occurs both in men and women at any age. Testosterone tends to occur more quickly in women at an earlier age, but we all have deficiencies in the hormones. Not all hormone therapies are created equal. Some have more side effects, some have more benefits, some are more problematic to utilize, some are easier to utilize. What you need to do is find a hormone expert and realize that one size does not fit all. You need to have your blood levels tested, and low levels may not be optimal for health. How do I say that? But also we have to balance things like vitamin D, your thyroid, cortisol levels. And these are what our patients are saying in our clinic, and patients across the country are saying, that after having their hormones optimized and having increased energy levels for the first time, there's restored interest in life, sexual activity has returned, their moods are more consistent, and in men it's very important to note that there's not increased anxiety with men with testosterone replacement, but a calming effect. There's relief from anxiety and depression. There's increased mental clarity and ability to focus. There's decreased body fat, increased muscle composition, and greater capacity for getting the body in shape. All of these above increased presence of productivity, wealth, and abundance in life. How would you like to have any or all of these? And if you want all of them, then let's jump on it. So what is BioTE therapy? BioTE is an American-owned company that produces the pellets that you're seeing here. It's a company aimed at helping you return normal hormone balance and optimal physiologic state, and is based on delivering the right kind of hormone, bioidentical, in the right amount, again with individualized dosing based on your weight, your age, your laboratory values, and using the right delivery system, the pellets, rather than using creams, gels, troches, or injections. There's over 80 years of experience in 5 continents using the pellets. There's at least 10,000 procedures being done in this country every month, and we have to, as a provider, report our procedures twice a month, and on the day of any bad issue, bad outcome, we have to report it that day. So we have lots of history, a lot of studies going on. I'll let you read this here. So how do you get started and get your life back? All you have to do is book a schedule with your BioTE practitioner. Blood tests will be obtained and a consultation will be performed, and your lab values will be discussed with you. Your goals of therapy will be discussed with you, and then should your hormones need optimizing, a plan will be devised using the right dose, the right route for you. And that's what the pellets look like. And with that, I think this is the last slide. I thank you. You can find us on our website at royhallmd.com or Facebook, Roy Hall MD.